Hello everyone. Welcome to Enzyme MBBS, where complex medicine becomes simple and exam ready. Okay, so without wasting any time, let's get started. Give the introduction for wound healing by primary intention. It is wound healing by primary intention, also known as primary union, is a type of wound healing that occurs in clean, uninfected wounds with minimal tissue loss where the wound edges are closely approximated either naturally or by surgical suturing. What does it mean? So, primary intention is also known as primary union. So, this occurs when the wound is clean and there should be no infection, because if infection is there, then there will be more inflammatory reaction, it would delay. So the wound should be clean and it should be uninfected, and there should be minimal tissue loss. If more tissue is lost, then proliferation should be more, so it again takes time. So the minimal tissue loss and wound edges are closely approximated. Okay, so this type of healing is typically seen in surgical incisions and sharply cut wounds. The healing process is rapid and results in minimal scarring. So that's it. That is introduction. Then give a definition, that is healing by primary intention refers to the process of wound repair in which closely opposed wound edges heal with the minimal granulation tissue formation, minimal wound contraction, and the thin linear scar. So there is a word again, opposed, closely opposed wound edges. What is apposition of wound? We discussed in one of the video that apposition of wound is nothing but the alignment of the wound edges should be proper. It shouldn't be here and there or scattered, or some one edge is here, another edge is little far away, it is not symmetrical. It's like that. Okay, so here we basically need the wound edges to be properly opposed. Next examples: clean surgical incisions, incised wounds made by sharp instruments, and lacerations closed by sutures or staples. What are the characteristic features? Whatever you have written in the introduction, here you are just mentioning it point wise. That is minimal tissue loss, clean and uninfected wound, wound edges closely opposed, minimal inflammatory tissue, absence of significant wound contraction, and small thin linear scar. Now, here I have written something, that is write steps of wound healing, explain each phase, tensile strength of healed wound, role of growth factors in wound healing. But we all these points have been discussed in another video. It is there in this playlist itself. There is a video called as process of wound healing in the inflammation and healing playlist. Go that if you have not watched it. All these things are as it is explained there. Okay, there is a flow chart and each phase have been explained, and everything what I have written here is there. So it is the same thing. The whatever that there is written, it is the same thing which happens in the primary healing or primary union. So refer that and write it. Then the only purpose of making these videos, this video, is there is something some more extra in that video other than this what I have written here. Ignore it, and there are some points which I have to need to add for this answer, which I have written in this video. I have given that in this video, so you have to basically mix it. See, all the questions will be provided you in the playlist. You can just watch it. Everything is there. You just have to make the use of it in a right way. That's it. Okay. Now, moving further, you have to write also about the outcome of healing by primary intention, that is rapid healing, minimal scar formation, restoration of tissue lining, and minimal functional impairment. Last but not the least, clinical significance. It is preferred method of surgical wound closure. So it will reduce the risk of infection, healing time, and cosmetic defects, whereas it is commonly achieved by suturing, staples, and adhesive strips. So that's all for this video. I hope that was useful for you. Show your supports by like and comments, and keep studying. Do well. All the best. Thank you.